The unique thing about Joe DiMaggio Children's Hospital really comes from the fact that this is probably the only center in South Florida that has the entire spectrum of cardiac care for patients with congenital heart disease.
With the arrangement with Memorial Regional Hospital and the Cardiovascular Institute and the Joe DiMaggio Heart Institute, there's no cracks for the kids to fall through as they transition into adulthood. We provide that safety net so that they really can get care from prenatal life through their adulthood.
At Joe DiMaggio Children's Hospital, there's been a very focused, very energetic effort to bring people who are true experts in their field. And we really have assembled a team that is second to none. And it shows in our results. We now have 14 patients that had sure death, non-survival, who are now home and thriving. And those types of results don't come by chance.
The program at Joe DiMaggio Children's Hospital is one that has really grown, has reached a tremendous level of quality and expertise, but one that I see is now jumping to yet another level.
Dr. Ed Bove, whose reputation is truly world-renowned, took an interest in us. We had brought him down here to do a site visit and make sure that we were doing things properly, and we thought we were doing a pretty good job, but it's always good to have some external validation. And he saw the bones of this program to be such that he thought something really great was going on here.
What struck me was some of the incredibly good results with some very complex and difficult patients that this institution, the team here, was already really achieving. I obviously had a link in knowing Dr. Bobevsky because he had trained at the University of Michigan, and so I knew him well. But I also realized when I came here that there were many of the cardiologists that I actually also knew over the years as well too, who I really admired.
Because this team has really grown together, there's day-to-day, minute-to-minute communication between the individual subspecialties. The ability to casually collaborate on cases like that allows for creativity, allows for ideas to emerge that are unique in terms of treating the patient in a way that provides the best long-term outcome.
I guess I would want to see some more information about the RV, perhaps with an MRI. Being a mentor is an important part of my life. So being a congenital heart surgeon to me was more than just doing the surgery, but was helping the next generation do it better, educating them, because I think that's really what you leave as a legacy.
Having someone who has built one of the most successful pediatric heart programs in the world involved with Joe DiMaggio Children's will be very important from a growth and programmatic development perspective. It's just a true gift to the region in South Florida.
We have a world-class program. We're doing everything right. And we get to build on that with some new partners that are really going to help take this to the next level so that we ensure that children not only have a successful operation or a successful intervention, but really have a successful life.
Joe DiMaggio Children's Hospital Congenital Heart Institute will be recognized as the place to go for your child to have their congenital heart defect cared for. And I think it will rapidly achieve that level of status in the entire southern Florida area, if not beyond.